What advice would you give to someone who's preparing to be the support person for a transplant recipient?
Some advice that I would give a potential caregiver for a transplant patient would be to attend these support groups that UCSF holds once a month. You get to visit with a lot of post-transplant people, caregivers, pre-transplant people, and it's a good way to just get on a one-on-one level with people, talk it, you can just visit, and it's very relaxed, and you can just learn so much from that. The doctors and nurses are always a great way to learn things, but they don't always have the time. And so the support groups was my number one way to learn about caregiving and what to expect.
Well, I think they should try to be as patient as possible, as loving. The recipients need lots of love and support. I think they do need to take care of themselves, though fortunately for my husband and I was a born caregiver, and it just was just nothing for me. It really wasn't. And I know a lot of people, it's very difficult, and I feel badly for them. And so I would think that if someone is having a hard time, then they need to have their family help them, so that they can have more time off or something. We had wonderful friends that wanted to come and stay with Bill so I could go get my nails done or whatever the 6 weeks that we were living away. And there was no time. We were too busy coming and doing our blood work and whatever. You see I always say our. But, it's just, I think if you need help, ask for it. And your family, I feel, is the closest person, people to ask for help, hopefully. So.
The advice that I would give to someone who is preparing to be a support person for a transplant recipient is be prepared to lay your life down completely. Let go of any and all agenda you have other than taking care of yourself. You need to eat right and you need to sleep right, and if at all possible, put in place a support network. If you have family in the area, we did not have family in the area, so that's why I was so blessed to have that friend that would come and stay with me. But you need to be prepared to invite people into your transplant experience to help you and support you. I'm a really strong person. I thought I was a really strong woman, and I am. I've been through a lot of things in my life, but I would never recommend going through transplant as a caregiver support person by yourself. Be prepared to give yourself breaks. If there's people that can come, a couple of times, towards the end of what was almost 3 months, the last 2 weekends, I said, I just have to get away. I have to. And it was interesting because my husband was in the same place too. He was like, no, we just need to get away from each other for a while. Because of course, for him, I don't think I was smothering him or mothering him, but I was being hyper vigilant about taking care of him, and he was beginning to feel a little bit suffocated, and I was beginning to feel like, if I don't get out of here, I'm going to go crazy. So plan, if you can plan, have people that you can trust, and be able to get away from the whole medical scene for a while. Let people know what you're going through. It's important to share, to be able to talk to somebody besides your loved one that got transplanted, because they're going through their own whole experience that they can't relate to what you're going through. So it's really important to have somebody that you can talk to, that's just going to listen to how you're feeling, or how you felt when the needle blew up in your face that morning at 5 o'clock in the morning, or how you feel when the alarm goes off on the feeding tube at 3 in the morning, how just someone to be real with too, because it is more times than often not a warm, fuzzy feeling to lay your life down in that manner for somebody you love.
If I was preparing someone to be a caregiver or a support person, I would say do a journal. I did a journal from the first day that Daryl was called to come to the hospital for his transplant for a year. And I logged in that journal every day, the stats, the important things that were happening, his condition, just everything. And when he came home, how far did he walk? Because he couldn't remember if he had walked 2 feet or 50 feet. He couldn't retain that. And so I would say, look, it's in writing, it's right here. You walked here yesterday and you walked there today. That's quite a bit of difference. So he could actually visualize it, see it, and go, wow, I did? So, and I could look up things that had happened. I could look up medications. So it was really instrumental in helping me. So that would be the first thing I would say is, if you can, do a journal. It'll help you a lot. And have someone also that you can talk to other than the recipient. You need someone, a best girlfriend, a dear friend, anyone that you can share with that will give you some feedback or just listen to you and let you cry a little bit. It helps.
Try to get as much rest as you possibly can. You can do anything. I think for me it was trying to be rested. Yoga helps, really does. I like that. It helped me.
Advice I would give to a caregiver is to be very, very flexible and to be very, very patient, because even with the best intentions, the person receiving the transplant doesn't know how to respond and react to all these new things. Their personality may change, their taste may change, their likes and dislikes may change. Everything is up in the air when they have a transplant because their whole life changes. She will continue to change, and we know that, and every day we have a new normal, and we get used to the new normal, and then something may change again. So we just really have to be flexible and very patient with the person who received the transplant, because she's the one dealing with all these changes. We're just kind of going along with it, and it's not her desire to be difficult or to feel sad or to feel sick, but her body is, constantly working, trying to keep these new lungs going. So we just have to go with what her body is doing. So we have to exhibit a lot of patience and really just be flexible. If you make a plan for the day and then the plan has to change, that's just the way it is.
Make sure that you're serious about it, because there's no room for error. You have to realize that this is a long journey, and the longer the journey, the better, because that's what it's all about. You want to extend the life of the recipient, and you also want to make sure that all along the way that the quality of life improves.
To prepare for being a support person, I suggest that you try and be as positive as you can be. That was a huge deal for us. After diagnosis, I cried for 2 days, and my husband said, okay, I need your support and strength. So somehow I gathered my strength and never turned around. We stayed very, very positive and supportive, and I just let go of some things. What I did for him is I let him do the research he actually has 2 different diseases, and I let him do the research for the diseases and to figure out what he personally needed to do to stay as strong and healthy as he could be. For myself, I also researched, but I did it more on a dietary level, where I was trying to figure out what kind of meals he could have to be as strong as possible. When we got on the lung transplant list, I remember Dr. Kukreja saying at one point, you just have to trust us. And that just hit home because I thought, you know what, we're at the best of the best. And even at Kaiser, they were so wonderful that I just let go and decided that, you know what, it's not for me to be researching so much stuff. I need to focus in on what I need to do and to just make sure that nobody is, that he's not sliding through the cracks anywhere. So, yeah. Also exercise, super important that the patient comes in as strong as possible. So to encourage them to exercise when they're not really feeling like exercising. And after surgery, to encourage them to get up and exercise, very important. To pack the car, that's a huge deal. And we had 2 dry runs, which we were grateful for. The first dry run, I was not as together as I thought I could be. So I ended up putting everything by the door, and we just lived out of our suitcase. I also wrote a list of everything that we needed, and I put it on the refrigerator so that when the call came, I could just put everything in the car and then go to the refrigerator and look at that list and make sure that I had everything that I needed. Also, it's really hard to live out of your suitcases. So when you wash your clothes, boy, get them right back in there. So as you're packing and getting ready to go, one thing that I found after the second dry run is that I was notifying people a lot of what was going on because they wanted to know. So at that point, I came up with an email group, which made a huge difference when he actually did have the surgery, or even before. We were in the hospital for 2.5 weeks before surgery, and people wanted to know what was going on, and it was getting more and more challenging to tell the story. So if I could just write one email and send it out versus to so many different people, it made a huge difference. As a caregiver, I recommend that you read through all the materials that are given to you by UCSF. I did that beforehand, and it was very, very, very helpful. I went in with really very few surprises, so read them all. I just sat down and poured through all the material.
Just embrace this opportunity. The advice I would give a caregiver is you have to remember that it's not just a matter of being a caregiver. You wear many, many, many hats. You need to provide care and comfort. You're like not only a personal care assistant or the note taker or just the listener. You're also the chauffeur, the mini pharmacist, and other roles that you play. And I hate to say this, but sometimes you're the mom too, okay? But that's the role that you need to play or to accept, and to be willing to understand or put yourself in their shoes and what they're going through. They're under a lot of medication, not thinking clearly, overwhelmed. So you are their support and their extra eyes and extra ears. So if you can remember those things, and there are times it's not always, it's not always work. You have to remember there's to maintain a level of humor, and it's all good. Another piece of advice I would give caretakers is this simple calendar was given to us when we were being discharged, and for me it was a lifesaver because I am a note taker and I rely on a visual to learn. So I would write down all my notes, all the appointments, because when you leave the hospital, you're given about 10 sheets of papers with appointments. You're given your discharge notices with the many, 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 many list of medications. And so and with start and stop dates. So this simple piece of paper and taking down notes was so helpful and beneficial. I don't think I could have handled things so well without it.
To prepare yourself to be a caregiver for a transplant recipient, I think you really need to not be afraid to ask for help. Make sure that your backup person is there with you when you're receiving instructions on what to do when you go home, and write things down. If you're not sure of the instructions, just say, hey, stop, please. I need to go back. Could you please explain that a little more? Just take time for yourself. They stress that. Oh, and going to support groups. We would attend the monthly support groups here, and they were invaluable. I would say, not only for myself, but for my husband, it really helped prepare him for the transplant. And a lot of things would be brought up at the support groups about things they went through. So when we were going through it, I thought, oh, this is okay. This is natural. This is normal. This is all part of it. Don't worry. Calm my husband down. So I think just to be prepared that way, take in as much information as you can from other people. Don't be afraid to ask questions, stop people, and have your backup with you.
I would advise any caregiver to seek out another caregiver that has gone through it. Not that is going through it the same stage that you are, but seek out someone that has already gone through it and talk to them, pick their brain, and ask them, to tell them the secrets that they had learned. One little thing can just make it easy for everybody, and everybody learns from everybody. Just seek out another caregiver and have them help you through it. I would just like for the caregivers and the recipients both to understand that you have a group of people here that are willing to answer questions for you and are willing to help you get through it. Don't feel that you cannot ask a question, that they'll think that you are dumb if you ask a question, because everything can be explained in such a way that maybe you didn't pick up every little thing and you're so overwhelmed maybe you missed one little tiny thing they told you before discharge. Don't be afraid to ask questions. It'll make your life so much easier, and give back to the program. They've given you a lot, so give back to them.